Hello guys, welcome to my channel chinedu iheonu. Today I just want to share this information with you. It's just a couple of things I came up with for somebody who went to work at the hospital. You know, sometimes you need to know what your goal is. You need to know what your calling is. Hospital is it's a delicate place to work, very sensitive, more like very sensitive place to work. And there is always job opportunity at the hospital. That's why everybody is now looking for a job to come to hospital, to get one. Maybe the pay could be interesting. Sometimes it's not, depending on what you want and what you're planning to achieve as a person. So, but I want to share with you some information that you need to know if you want to work at a hospital. Not knowing there are so many things that you need to know about hospital, something that will guide you to secure your job, not have a problem, Let's say, for instance, you're a lazy person. If you're lazy, hospital is not for you. You know why? Because you're going to be having problem with your patients. You're going to be having problem with your co-staff. You're going to have a problem with some nurses, and even have problem within yourself, because you're going to feel disappointed. Imagine coming on a shift and you're being given 5 to 10 people to take care of, and every 30 minutes or 1 hour your phone will be going off. This person will ask you for this person will ask you. If you're not coordinated, you become confused. So you have to be on your feet all the time. Let's answering calls from patients. Then one thing people don't understand, every hospital have a policy and conduct. You got to make sure you adhere strictly to the conduct of that hospital. Because every single thing that you do, you are responsible for those. So you have to be very, very smart to know all those policies and conduct, because if you're not, you're going to lose your job and you'll be frustrated. The hospital will do what? They'll fire you. Also, if you're this type of person that is not honest to yourself, when you come to hospital, sometimes whatever you tell your patient, sometimes they would communicate back to you. They would tell it to anybody that comes in your room. So if you are the kind of person who like to tell lies, it's going to affect your job. Guess what? You might tell lies and that lie will come at you. So you're going to end up losing your job. If you have anxiety problem, please, I'm advising you with experience, be on medication, or else your anxiety will be on the roof. Because what you're going to see, the pressure they're going to put you through from either your co-worker or the patient or a family member or even the environment, will put you on edge. You can end up becoming a patient yourself. From being a worker, then you become a patient, because you have to be anxious every single time. So you got to be careful. Take care of your anxiety issue before coming to the hospital. Then one thing I want to share, which is very important, is anger issue. Please, hospital is not for you. Guess what? The patient, they're going to press a button. They're going to press a button to push you to say something. Okay, imagine if a patient press a call bell and you come to answer the patient, and the patient start cussing you out, calling you all sorts of negative words. And then if you are angry, You might feel like, I want to punch the patient on the face. We can't do that. We can't do that. You end up in jail. So if you have an anger issue, go for anger management. Sort yourself out. See therapy. Get yourself on the right track. Then you can come and apply for a job at the hospital. But if you are a person who also very disrespectful to people, you don't know how to watch what comes out of your mouth, you don't need to come to hospital, because if you curse the patient out, that someone is in the hospital doesn't mean the person has lost their mind. Some there because of some medical issues, some are well oriented. So if you disrespect them, they will report you, then you'll be fired. You might even lose your license. So these are the things I want to share with you for you to have at the back of your mind. If you're looking for a job in the hospital and you have all these characteristics I've mentioned, do not, please, fix yourself. Talk to people to give you idea, or if you have those things, maybe a few of them that you can manage, then while you're in the hospital, you can fix yourself and get some help. And listen to your colleagues, because there was this incident, a patient keep on pressing somebody's button and the person's anger built up. He beat up a patient. He lost his job on the spot. So you don't want to be that kind of person. So get yourself straight. Another thing I forgot to mention is, if you are a drug addict, please don't come to the hospital to look for a job. Because guess what? You'll be tempted to do something. Maybe you are high, you come to work, and then you might end something that will cause the life of a patient. Please, it's very, very important. Get yourself straight. Get yourself therapy. Do something that will make you the right person, a right syndicate. When you come to hospital, you do your job. When you do your job, you go home and still have your job. I wish you the best. Share this video to anybody that you know that need to watch this video. Thank you. Subscribe. Put on your notification bell for more videos like this. And bye-bye.
Nope.